Hello, my health promotion video is on gastroesophageal reflux disease, or GERD. The pathophysiology of GERD is complex and involves changes in the exposure to gastric acid, epithelial tissue resistance in the esophagus, and visceral sensitivity. GERD occurs when acid from the stomach refluxes into the esophagus and it irritates the mucosal lining of the esophagus. It has risk factors including obesity, hiatal hernia, pregnancy, pyloric stenosis, and peptic ulcer disease. A photo here of a healthy stomach shows the esophageal sphincter here is closed off, and that contains the stomach content in the stomach. A GERD stomach, the sphincter is more relaxed and more open, and that allows the stomach content to reflux back up into the esophagus. Stomach content is very acidic, and it causes damage to the lining of the esophagus. Some symptoms for GERD include heartburn, indigestion, regurgitation, dysphagia, painful swallowing, chest pain, nausea, bad breath, trouble sleeping, tooth decay, vomiting, feeling a lump in the throat, and belching. All of these symptoms can be contributed to that reflux into the esophagus. Bad breath, you have the acidic content back in the throat, nausea, tooth decay, that acidic content comes back up and it can wear on the teeth. Dysphagia, trouble swallowing, feeling that lump in your throat. Diagnostic procedures for GERD include a CBC, checking the iron levels, the gastrin levels, a gastric acid analysis, and they can monitor the pH of the esophageal area. Nursing interventions and patient education kind of go hand in hand with GERD. We want to first obtain a weight and a nutritional history on the patient. We want to teach our patients not to eat and then go to bed, because going to bed with a full stomach causes that reflux to worsen. So they need to avoid eating about 3 hours before going to bed or laying flat. Instruct them to sit upright for about 2 hours after eating to help that digest down into the stomach. Some diet changes we would like to teach our patients about GERD. Avoid caffeine and alcohol, citrus and chocolate, high fat foods and high acidic foods, peppermint, tomato, those acidic foods cause GERD to be worse. Teach them to eat smaller servings and eat very slowly, chew very thoroughly, and avoid eating before bed. Some lifestyle changes we can teach our GERD patients include elevating the head of the bed, stop smoking, maintain that healthy body weight, and wear loose clothing. You don't want any clothing constricting around the stomach, encouraging that to reflux. There are some surgical options for GERD. They may do an endoscopy or an upper GI series. There is an esophageal manometry study they can do, and there are several surgical procedures, including the Lynx and Stretta procedure. Those are aimed at tightening that sphincter to the esophagus. Also, medication therapy include antacids, H2 blockers, proton pump inhibitors, and prokinetic medications. Complications that can occur with GERD include esophageal ulcers. So those are ulcers developed in the esophagus from the acid reflux, esophageal strictures, and Barrett's esophagus. Barrett's esophagus, all the acid reflux actually changes the parietal cells in the tissue of the esophagus and can make you more at risk to developing esophageal cancer. With the NLN nursing judgment competency, we need to assess that our patients, our GERD patients, understand the lifestyle changes, they understand the medication compliance to their treatment plan, and do they have the ability to follow through with it, or else their symptoms and their GERD is not going to get any better. We can discuss some of the medication treatments for GERD. Over-the-counter Tums, they help treat some of the symptoms of GERD, such as heartburn and indigestion. They are calcium carbonate and they are used as needed. Antacids neutralize stomach acid. They're made from aluminum, magnesium, or calcium. Contraindicated in patients with renal failure, a bowel obstruction, or severe electrolyte imbalances. Omeprazole is a once daily over-the-counter proton pump inhibitor. It binds directly to the hydrogen potassium ATP pump and inhibits secretion from the parietal cells. Contraindications with proton pump inhibitors are pretty slim, just allergy. They don't really have a lot of adverse effects either. H2 receptor blockers. This is Pepcid. It's a daily medication as well. It's over the counter. H2 receptors block the H2 receptor of acid-producing parietal cells, making them less responsive to the stimulation of gastrin. Contraindications to H2 blockers are renal impairment, hepatic impairment, and allergy. These three medications are over the counter. If they don't work to treat GERD, you can go to the physician. They can give you a prescription medication. They may prescribe something like Carafate also that coats the lining of the stomach to prevent gastric ulcers and esophageal ulcers. Along with medication management, the lifestyle changes and diet changes that we discussed, like avoiding the trigger medications, not eating before bed, stop smoking, all of those are necessary to make this treatment effective. So I would like to do a little Q&A after this health promotion video. So question 1. Pregnancy is a risk factor for the development of GERD. True. Question 2. GERD can increase risk of esophageal cancer and ulcers. True. Question 3. Proton pump inhibitors should be taken as needed. That one's false. They should be taken daily. Pumps can be taken on an as-needed basis. And question 4. Bedtime snacks are encouraged for patients with GERD. That one's false. Patients should wait about 3 hours after eating before going to bed.